During Monday, June 21st, White House press briefing, White House Press Secretary Jen Psaki fielded questions from reporters on the Biden administration's efforts to increase vaccinations in the United States.
Based on the current projections, it does not look like the president's July 4th target of getting 70% of the population at least one dose of the vaccine will be met. Of course, the administration has try to incentivize vaccinations along with corporations and other partners. What else can the White House do at this stage to try and change the trajectory of vaccination rates? And what are the concerns of missing that target in terms of the president's desire to get back to normalcy?
Well, first let me say we've made tremendous progress in our vaccination efforts to date, and the ultimate goal has been to get America back to normal, as you said, and we're looking forward to doing that even here at the White House. As you know, we've invited over 1,000 essential workers and military families to join the president on the South Lawn and many more with fireworks on the Mall. What we've seen over the course of the past couple months in terms of progress is a massive reduction in the number of COVID cases by about 90%, a 95% reduction in the number of deaths that are down. That's significant progress. We set this bold, ambitious goal because we wanted to continue to make progress, and we're doing exactly that. We've seen 16 states meet it. What we've seen as we've dug into the data is that there is a big gap between individuals 25 and over and 18 to 25. 18 to under 25. That means that's an area we need to continue to work on. Now, regardless, even if we do sail past the 70% goal, we're still going to be vaccinating people on July 5th, on July 7th, on July 10th. That is still going to continue to be part of our objective. But as we dig into the data, we know that what we're seeing is a lower rate among young people. That's concerning, especially with the Delta variant being on the rise as it is, which does not discriminate by age, which still could cause death, serious illness. I expect in the coming days you'll get an update from our COVID team on where we are on the data on the different categories as they dig into it, so I don't want to get ahead of them, but we're going to continue to run through the tape. We're also going to continue to be focused on where we can raise the rates and raise the numbers where we see there's a lower uptick of vaccination.
And in terms of the president's trip later on this week to North Carolina, the White House, the administration said early on that when it came to vaccine hesitancy, a big part of the strategy was relying on local physicians, local governments as well to kind of take that on. There's the vice president took a trip recently, the first lady's taking a trip, now the president taking a trip. Does this mark kind of a shift in strategy when it comes to combating vaccine hesitancy, and when it comes to that specific demographic you described, younger people? What really do you do to convince those people to take vaccines at that point?
Well, first I would say no. Where we've invested our funding is in empowering local trusted voices, whether they're doctors or clergy or civic leaders. That continues to be the case. At the same time, of course, the president and the vice president of the United States should be out there advocating for the impact, the efficacy of the vaccine and the impact. And as a part of our month of action here, a month-long campaign, it's absolutely appropriate for them to do that, in our view. As it relates to young people, I think we'll use some of the same tactics we've deployed with a range of communities, right? Which is trusted voices, which is ensuring, if a college roommate or a former college classmate got the vaccine and now can go out and feel safe going out to restaurants and concerts, that's pretty effective. Maybe even more so than the president of the United States appearing in their local newspaper. That will continue to be an area we invest. We've also continued to make it as accessible as humanly possible. That's something we can do from the federal government. We've seen that as a barrier in the past. We've made progress. We've seen that as a barrier. We'll continue to do that as it relates to young people.
Thanks for watching. Subscribe to get more updates on COVID-19 and videos like this from the White House. For Reflect News, I'm Brendan Plank.